Hello, hello, everyone. Welcome to another live Q&A with Winona. This is a great place to learn, connect, and really just get some real answers from our amazing doctors. I'm Maddie. I'm Winona's community manager. I always forget to introduce myself, so really wanted to make sure I did that tonight. But we are just so glad you're here, whether it's your first session or whether you've joined us before. We're just like really glad that you're here tonight. If you're new to Winona, we're all about helping women feel like themselves again, from menopause support to hormone therapy to building a community that really just makes this stage of life um, empowering instead of isolating. So, as we get started, just as a heads up, you should be able to find a chat button at the bottom of your screen. Looks like Lola just said hello in there. Hey, Lola. So if you're looking for that, it's like a little box and it has some lines in it. You can click on that. But you can go ahead and just start dropping your questions in the chat. It often gets pretty crazy in here, so I would recommend getting your questions in there quick. It can be any questions, no matter how big, no matter how small, go ahead and throw it in. This is your chance to get them answered live by one of our amazing doctors we have here today. And they're really here to help you understand, what's going on in your body and then also what options are available to you. Before we dive in, though, so I'll also give you a chance to kind of get some questions in there. But I just want to share a few ways you can stay connected beyond tonight's session as well with Winona. You can join one of our in-person meetups, Winona meetups in your area, or you can even host one yourself. If you do this, you'll get to chat with me a little bit. I think they're super fun. They're also completely free for you to host. We cover all the costs. Essentially, you get to hang out with your friends and women in your community. It's really a win-win. Please do one. I think that they're amazing, but they're great ways to connect and spend time with other women who are in a similar life stage. If you're a podcast lover, you can check out the Menopause Hour with Winona on Spotify. They have practical advice, there's science-backed insights, and there's also like we talk about honest conversations that are happening on there. It's really a great podcast to give a listen to, whether you're driving home, you're on your way to the gym. Great thing in there. And then also, if I don't know if we have any bookworms in here, but we do also have our Winona Women's Book Club. It's exclusively right now for Winona patients, but in that book club, we take every month, we dive into a new book, and we really engage in really discussions about womanhood, health, self-discovery. We do have like a good alternate amounts of fiction and nonfiction, so there's definitely something for everyone in there. And then also just finally want to make sure you know that you can explore the Winona Circle in the app. If you're here, you probably have an idea about the app, but that is where you'll find event updates, ongoing discussions, and then it's just like lots of supportive spaces to really share about your journey, connect with other women, make friends. There's something for everyone in there, like resources and all kinds of things. But with that said, I think we can go ahead and kind of jump into everything. I'll hand it over to Dr. Kat to introduce herself, and I don't know if there's anything she wants to talk about, but then just a reminder, as Dr. Kat's introducing herself, feel free to throw some questions in there, and then we will get to them in just a moment.
All right. Well, thanks, Maddie. That's a lot of information. Hopefully, plenty of the women on the call will take advantage of some of those things too. So, I'm Dr. Kat Brown. I am the medical director at Winona, and I'm also one of the prescribing physicians in a handful of states as well. I'm a board certified OBGYN, have dedicated my life and my career to women's health. And as I am one of you, and as I'm an aging woman myself, I'm also in the thick of it with you in life, in my own transition in perimenopause. So certainly I can speak from experience as to what my experience has been, but I can also commiserate with you because I'm going through it as well. So this is something that's very near and dear to my heart, and I felt very ill-equipped when I started going through perimenopause and started noticing symptoms. I really was taken by surprise and didn't really know what was happening. And so it's my mission in life to help educate and get the knowledge out there. And we want you to share with other women as well, what you learned tonight, and hopefully, using some of the resources that we have. And while you're starting to get your questions in the chat, Normally at the beginning of our webinar calls and these Q&As, we talk about topics that might be of interest. And March is an interesting month because there's several different things happening in March. Number one, it's Women's History Month. So for all the women on the call, this is a month that's very momentous to kind of go back and, honor those women that were trailblazers, that changed our lives for the better, and the things that they did and the things that they fought for, like voting rights, the ability to have a credit card and a bank account, own land, things like that, and all the things that women did to kind of make our existence more equal to our male counterparts. We were so grateful to them for that. Also, as a doctor, I would be remiss to not tell you it's Colorectal Health Awareness Month as well.
Mm.
So as we are aging as women, one of the other important things, while we're always dealing with, perimenopause and menopause changes, as we get into our mid 40s and even our early 50s, the other thing that we have to start thinking about, all patients do, but women too, is colorectal cancer. So if you've not had the discussion with your doctor, like your primary doctor, your family doctor, about how to screen you for colon cancer, this is one of the leading killers and cancers that is killing patients in America, especially because we have highly processed diets. There's more and more information coming out about the foods we eat and how it's contributing to cancer in the rectum and in the colon. So it's time for you to start getting screened, and that's with a screening colonoscopy, which is not fun. You have to do this awful prep where you drink a bunch of stuff or take some pills to kind of clean your gut out. And then they put you under anesthesia and they put a camera up your rear so that they can look at the inside lining of your colon and your rectum to screen for cancer. But it's very, very important to do this because if it can be caught early, you can live a very long life. But if a cancer grows in that area and it goes unchecked, it can kill you. So it's one of those necessary evils, kind of like going to the dentist and getting a pap smear, these things that we have to do to keep ourselves healthy. It's important to do that. So that's my spiel and my plug for that, to make sure that if you haven't had that conversation yet and you're 50 or older, you need to start planning one if you have not had one already. And lastly, March also houses the National Doctors Day. And actually, this is the first year in my life that I've noticed they've actually expanded Doctors Day, which is an appreciation day, to actually an appreciation week, which started yesterday and goes, I think, to early next week. So, not that I want to toot my own horn, but I want to encourage you that if you've ever had amazing doctors out there that you love, that do wonderful things, like, this is the week you're supposed to give kudos to them. So if you're somebody that's been very special in your life and a doctor that's touched your life, don't be afraid to send them a shout out, put a nice Google review on for them or something like that, something to appreciate them during this, National Doctors Week. So that's my spiel. Those are the three things going on for March.
Absolutely. Well, thank you so much, Dr. Kat, for introducing yourself and going into, I think, all of those kind of topics. I think those are all so important to chat about and really just kind of open a discussion on as well. It looks like we have a couple questions in the chat.
Ooh.
Our first one is from Lola tonight. And Lola says, I am using the Winona bi-estrogen cream, but she says, but I'm wondering how the cream differs from HRT delivered through a patch.
It's really just in the mode of how the medication is transmitted into your body, really. So the cream you apply once a day, the medication's absorbed and the hormones get into your bloodstream via the skin. And the patch, it comes through the skin as well, only the patch, you apply it and change it twice a week. So it's a slow release that the hormone is released from the patch through your skin over that time that the patch is in contact with your skin. And it's really, they're the same medication. They're both considered transdermal or via the skin methods to deliver the hormones, which is safer than taking them orally. But it's really about what is most convenient for you and what you can fit into your lifestyle the best. So, if you're someone who wants to try the patch, you certainly can do that. I've had some patients over the years that, maybe react to Band-Aids, or if they get blood drawn, they react to the sticky medical tape. It makes them get a rash. The patch is not a good option for you if you're one of those people that has super sensitive skin and reacts to adhesives like that. So the cream is a good option, but it's really like trying on clothes. It's really about trying what you think you can incorporate into your lifestyle the best, because the best HRT is the one you take regularly so that you get those hormone levels to a good level so that it helps your symptoms and helps your life feel better and you have a better quality of life. So.
Absolutely. And our next question is from Katie. And Katie, she says, my ear ringing has been lower, but I feel like my weight is still going up. She says, it's only been 2 weeks, but I'm wondering when I will see a change of my weight going lower.
Yeah, so this is one of the things that's it's hard for women to understand, but weight changes, and especially the weight distribution that you'll notice the changes, is one of the later benefits of hormone replacement therapy. So, when we take hormone therapy, often you get like early relief of things like hot flashes and night sweats once you kind of get those hormone levels to a therapeutic range in your body. But the long-term benefits, like the reduced joint pain, and the weight loss or weight redistribution, like changing the belly and starting to get better muscle mass, that is going to be one of the later benefits you notice, like after you've been on hormone therapy for at least 5-6 months or more, because it's all about reversing this very high stress state that's going on in your body and getting your body into a kind of happier place and a happier rhythm. And then your body, with the other changes that you have to make, because hormone therapy alone is not going to make you lose weight, but what it's going to do is it's going to help you sleep better. You're going to feel better. You're going to be able to move better when your joint pains aren't bothering you so much. And when you do that, the dietary changes, like eating, healthy, fresh vegetables and fruits and getting plenty of protein, will actually start working to help you to lose weight if you're trying to lose weight. Right now, it's like if you're in that high stress state and you're going through all these symptoms, no matter what you do, your cortisol or stress hormone levels are so high that no matter how much calorie restriction you do or how much healthy eating and exercise you do, it's like a losing battle. Like you still can't seem to lose weight. And so once you get the hormone therapy on board, it reverses that process. But it takes some time before your body gets out of that state until you start noticing the benefit of the weight loss.
Absolutely. And we have a question, well, kind of more of a statement, but question as well from Stephanie. Stephanie says, all of my joints hurt, literally all of them. She doesn't quite say like whether she started medication or where she's at with that journey, but is there something you could speak to a little bit about that, Dr.
Yeah,
Kat?
it's very, very common as we lose estrogen for many women to experience joint pains kind of diffusely through their body. Also, if you've ever had joint issues in the past, like even when you were younger, if you've ever had a knee injury or a hip injury or anything like that, those tend to come back with a wicked vengeance when we lose our estrogen. So hormone therapy can definitely help that. But the other important thing is too that there are other medical conditions that can also cause significant joint pain too. So if you suddenly are noticing a lot of symptoms, it's still worthwhile getting it checked out. There are other issues like rheumatoid arthritis or even regular osteoarthritis, autoimmune conditions that some patients will get, that sometimes can cause diffuse joint pains. Things like multiple sclerosis can also cause joint pains and stiffness. So it's important not to ignore the other possibilities and make sure you still see a doctor and get checked out. But hormone therapy, if it is related to the hormone changes, can definitely help.
Absolutely. And our next question is from Bernadette, and she says, should we continue with collagen intake as well? And she says, anything else we should be doing concurrently besides water, protein intake, and exercise?
Yeah, I mean, I think that I will not tout to be like an expert in nutrition. I'm a physician. I'm not like a nutritionist or a dietitian, but there's more and more information coming out about supplements like collagen supplements and creatine supplements, that can have health benefits, especially for women as they're aging. And it's hard to know what's good. The best thing I can say is when you're thinking about taking an extra supplement like that, make sure you do the research. Make sure that the company you're getting it from is some company that's reputable, and that it's safe. You never want to take a supplement that could cause harm. You certainly want to look in and do your own research. But yes, water intake is so very important. The main benefit, like basic things I tell patients as far as a diet, is try to eat things that are perishable. When you go to the grocery store, especially in the United States, most of the grocery store is this shelf stable stuff in the core of the store that if you put in your cupboard, it can last for years. That's not the healthy food to eat. You want to eat fresh vegetables, fresh fruits, proteins, make sure you're getting dairy if you're not lactose intolerant, to get the calcium and things like that. It's the periphery of the store, all the fresh things that can go bad that are the healthiest things for you. And unfortunately, sometimes like the worst foods for us are the cheapest ones to buy, and it's more expensive to buy the healthy foods. But that's what you want to really focus on, like eating lots of different colors of the rainbow, eating lots of different colors of vegetables to get all the different nutrients that you need, lots of different colors of fruits, trying to incorporate like healthy fiber into your diet regularly from fresh fruits and vegetables. And the protein is so very important too. Even if you're a vegetarian, there are so many good sources of good protein out there that you can get too. And that's one of the biggest things that, as I have been aging and doing research, I realized I was really under eating a lot of protein. And it leaves you, if you're not getting enough protein in your diet, it leaves you feeling weaker. You lose muscle mass at a rapid rate as we age. So it's so very important to get enough protein in your diet. And if you can't eat it with meals, you can't like stomach the amount of meat or other protein sources that you would need to take in to get enough, like for your height and your body type, protein drinks or protein bars. There are so many different options out there these days that you can get to help supplement your diet, to kind of help get enough in your diet. So that can really help as well.
Absolutely. And our next question tonight is from Natalia. Natalia says, "Thank you for the session." She says, "I'm really glad to be here." She says, "I'm 42, and my question is how to tell the difference between nighttime GERD symptoms and perimenopause symptoms, especially when it comes to hot flashes or night sweats." She says, "I've already adjusted my diet and eating habits, and I recently started progesterone, and lately I've been feeling more gassy in the mornings. Is this considered a normal side effect?"
Yeah, anytime you start a new hormonal medication, whether it be like a birth control or you're taking hormone therapy, it can change your GI transit time, like the amount of time it takes for things to get through. You can get the side effect of bloating when you start hormone therapy as well. So it's not uncommon to notice that. And progesterone levels, especially, like progesterone can sometimes really slow things down and really cause more bloat as well. It can cause constipation in some patients as well. So you might need to make some adjustments to your diet to kind of help mitigate that. But usually those side effects are early on as you're first starting a medication, and things get better as your body acclimates. As far as the other question, I think earlier on in her question, she mentioned like, how do you tell the difference between hot flashes
Yeah.
and GERD symptoms?
Yeah.
GERD, for those that don't know what that is, GERD is basically the medical word for reflux or acid reflux. It's gastrointestinal reflux disease, which is the GERD. Um, Basically, this is your classic heartburn. This is when we get like, you burp and you kind of feel like you're regurgitating food, or you might feel like a burning sensation in the back of your throat. Some patients actually will experience what feels like chest pain, but it's actually irritation of their esophagus, which is that tube that takes the food from the back of your throat down to your stomach. And so those symptoms tend to happen when you lay down at night. They can be worse with eating spicy foods or acidic foods. And so usually the first line of treatment is to try to avoid triggers and take foods out of the diet that make it worse. Also eating smaller amounts of food, not eating a large bolus of food that kind of sits there and has more of a risk of kind of regurgitating back up. Whereas hot flashes, all of a sudden it's this onset of feeling warm and feeling like you get flushed in the face, and it's kind of like a heat wave that kind of goes up and down your body. Mine usually starts, and every woman's a little different. Mine usually starts in my core. So it's like in my chest, my neck, my face. Some people will actually say I look red if I have a hot flash when we're talking. But some women will feel it all over their body and might even break into a sweat. And so it's very different. It's not so focused like in the throat and in the chest. It could be happening over all of your skin mainly. And I've heard people refer to them as personal summers or heat waves. But basically, that's the main difference between those symptoms and what you would feel with one versus the other.
Absolutely. And it looks like we have a question next from Katie. And Katie says, "Is it better to do the estrogen cream in the morning or night?" She says, "I usually use it at night." And she says, "And I take the DHEA at night as well, which has allowed me to finally sleep, but I'm not sure on the cream."
Yeah, the cream is actually probably what's helping you sleep better. The DHEA tends to help with fatigue and help give energy, but it all depends on how long it takes your body to metabolize it. So generally, our body, we have our own DHEA that's made in our adrenal glands, which are these little glands that sit on top of our kidneys. And typically our bodies release it naturally in the morning. So I usually tell patients to start their DHEA in the morning because it can kind of help with your daytime energy and help combat that fatigue that we kind of all get midday, especially after lunch. So it's usually the estrogen and progesterone component of your cream. If you're using that at night, that's probably helping your sleep more. So you can play around with it, but the best time to take the HRT is when you can remember to take it regularly and when you can fit it into your day-to-day schedule. So most patients will start it in the evening, especially the cream, because it does help with sleep. I usually recommend the DHEA in the morning, like I mentioned, but every patient's different and your body might respond differently. So if you have concerns or questions and you're one of our patients, you could always reach out to your Winona doc on the portal and ask them questions about what they recommend, for the time of day that you take it too.
Absolutely. Well, yeah, for the moment, I'll give some people another few more minutes to get a question in if they have something else they want to ask. But I guess just Dr. Kat, for the women that are on the call, I think that there's often just a lot of questions kind of that surround HRT, that surround DHEA. It kind of also like surrounds the Winona experience and like what comes with that. Just like what do you think would be helpful knowledge for women to kind of know about? Whether maybe they're just getting started or they haven't started yet, what would be something good for them to know just kind of as they're diving into this process?
I mean, I think the most important place to start is just to learn as much as you can, kind of knowing where you're at in your menstrual life and what your periods are doing and what your body is doing. Start to take an inventory of your symptoms if you're starting to experience symptoms. Like I always encourage patients to do a symptom diary, but I would dive into educating yourself about perimenopause, about menopause, about what to expect, about what's happening physiologically in your body because that knowledge is so powerful. And once you learn, you can kind of expand upon that learning so that you're more empowered to kind of take the next step and advocate for yourself if you need to. Because every woman is going to go through menopause at some point. It's not a matter of if, it's a matter of when. And the average age for most of us to go through menopause and to be completed is 52, but we can have symptoms for up to 10 years prior to menopause happening, and some women are younger on that spectrum. Some women are more late bloomers when it comes to menopause too. So you never really know when it's going to happen. I encourage women to start having conversations with other women in their lives too. So if you have sisters, your mother, talk to them about their experiences, see what it was like, because we tend to follow trends in our families when it comes to our reproductive health. Not always, but it's something that we can follow patterns, after the older women in our lives. So it's important to talk to them about their experiences too. And make sure that when you're reading and you're trying to do more education for yourself, that you're getting the information from a reputable source. So it's not always the best answer to just get on Google or to get your information from Instagram or Facebook, unless you're following like a doctor who's sharing information or a medical healthcare organization like ours, like Winona, or the American College of OBGYN or the Menopause Society, where you're going to get reputable information. One really good source everybody has access to, and it's free, is if you go to our Winona webpage, we actually have a medical journal section. Like if you pull down the tabs, I think it says learn, you can actually search any topic, any information that you're curious about, any symptom. And there is a nicely written journal article around that topic that has been curated by one of our doctors. It's been checked for medical accuracy as well. And they are a great source of information and knowledge for patients, and they're totally free and they're available to everybody, because we really feel strongly about making this information accessible to everyone so that, all women can benefit from it. So definitely do that too. So, read as much as you can, learn as much as you can.
Absolutely. No, I completely agree. I think that Winona has some really top tier stellar resources out there, just like for helping women kind of learn more about the journey and what that looks like. And on that note, Lola has had a comment kind of about that might be good to kind of chat about a little bit as well. She says, what's frustrating is that I have been educating myself a lot about this for 5 years. But she says, but my primary care doctor is still stuck in the mode of HRT causes cancer and menopause is not a disease that needs treatment. And she says, and I say to her, wasn't it shown that the 2002 Women's Health Initiative study that suggests a cancer link has been debunked? And she says that her primary care doctor says no. I don't know if you have any thoughts on that, Dr. Kat.
Yeah, this is a hard thing because the thing is that you may love your primary care doctor, you may have had great experience with them, but in this arena, like at this point, it's going to be really hard to change someone's mind. We are required as physicians to do continuing medical education and to stay up on the latest and greatest and all the research that comes out. But especially when it comes to primary care doctors and family doctors, they have to know a little bit about everything. So unless they really have a keen interest in learning more about perimenopause and menopause, it just may not be a priority for them. I've had patients kind of subtly, slip their doctor's information or send them articles. One of the most informative things that you could do would be to share the link to the FDA panels on the FDA had an expert panel on HRT last summer where they invited all the experts, to talk about hormone therapy and to give like a quick snippet and to show data and to pull the research and make a couple slides about why estrogen is safe and why it's better for bone health and all kinds of things. It's really available for anybody to watch. Anybody on the webinar tonight can actually watch it. If you just Google FDA expert panel on HRT, you'll come up with a YouTube link from the Food and Drug Administration. It was held in July of 2025. That is probably the most high yield, quick amount of information that you could get, from a medical standpoint to learn. But you could be blue in your face trying to talk your doctor into it. And what I always encourage patients to do, if you have a doctor that's not comfortable with this and you really want to see somebody in person and really make sure that they're on board, you need to flat out ask your doctor, are you comfortable treating this? Do you feel like this is something you're experienced with? And if they say no, or they say they don't believe in it, then you need to ask them who they would refer you to. Basically to be able to get the information and the care that you need. And if they're not willing to refer you or they don't know somebody that they would send you to get better care when this comes to this particular medical issue, then it might be time to find a new doctor. That's the thing. It's like if you feel like you're not being listened to or that you're being dismissed, that's a big deal, and I think it's very important that we advocate for ourselves until we get the help that we need.
Absolutely. And we do have another question that came through from Erin. And Erin says, is the estrogen cream enough, or do women need progesterone or even testosterone, or does it depend on the individual?
It really depends on the individual. The main reason for progesterone is to protect your uterine lining while you're taking estrogen. Estrogen is really the heavy hitter when it comes to hormone therapy. That's what's really helping many of the symptoms that you're dealing with as your body's going through all these changes. But if you still have your uterus, meaning that you've not had a hysterectomy, you need to take progesterone along with the estrogen, because the one negative thing it can do is it can cause that lining of the uterus to overgrow. And if not, mitigated by the progesterone, that can lead to the development of, hyperplasia, which can lead to uterine cancer, which is cancer of the lining of the uterus. So if you have your uterus, it's very, very important that you take progesterone while you're taking estrogen. So every woman should learn that. Now, testosterone is something that's, available out there. We do have testosterone. Our bodies make testosterone. And there are different things that the testosterone addresses compared to estrogen, but they both work together to really make our bodies the healthiest they can be. However, testosterone is not FDA approved for women, and there's actually no female, specific products that are testosterone that are like specifically made for women. So when we treat with testosterone for patients, we're actually using male products and trying to kind of like extrapolate that to a woman's physiology. So hopefully that will change in the future. But right now, testosterone is highly regulated depending on the state. And it's considered a controlled substance because it's widely abused by like the weightlifting community, bodybuilding community, and the military, because it can make you stronger. It can make your muscles get stronger and help you perform better. So athletes have used it as well. So, some women do need testosterone to help with energy, to help with libido and sex drive. The way that we get around that is by giving you a supplement. At Winona, we use something called DHEA. which is dehydroepiandrosterone, which is a precursor hormone, which is a supplement that we order along with hormone therapy for many patients. Because as your body metabolizes this supplement, it breaks it down into low levels of estrogen and testosterone. So it's like a gentle way to boost your testosterone level without actually prescribing testosterone. So that's something that we do instead.
Absolutely. Well, that looks like that is all of our questions for tonight. So I just want to say thank you so much, Dr. Kat, and thank you everyone also who has like joined us tonight. We're always so grateful, really, just to spend this time together, spending some time answering your questions and really just helping you feel more confident and supported on your health journeys. Also, if you think of more questions later and you're a Winona patient, just remember that your Winona doctor is always available through messaging in your patient portal, and you can reach out to them anytime for guidance or any follow up care. And then I know we talked a little bit about this at the beginning, but just before you head out, I wanted to send a reminder as well. That you can check out the Winona Circle in the app, and it's really the best place to kind of stay in the loop about any upcoming Q&As like this, book club sessions, Winona meetups. It's really where real community happens. It's where women are connecting, sharing, and really just supporting one another every day. And then also, if you haven't yet, maybe take a moment to explore what Winona offers. There's personalized treatment plans, like Dr. Kat was saying earlier, really a library of educational resources and free resources that are great to like look into. And it's really just a growing network of women who are redefining midlife. So I just want to say thank you again, everyone, for joining us tonight.
Yeah, thank you so much for taking the time out of your evening to be with us.
Absolutely. Awesome. Well, have a great night, everyone. Take care, and I hope you have a wonderful evening. We'll catch you all next time.